topic is Squamous Cell Carcinoma sole. Hello dear students, we will discuss a topic which is quite common. One of the cutaneous malignancies or tumors. Just have a look at this. See that sole, there is a ulcer which is slough or no healthy granulation tissue at all. And edge, look at that, edge is everted one. Typical. You know that this is the ulcer, this is the base. Base is felt only, not seen. 4 is seen and felt. This is the edge. Edge is seen and felt. Margin, this is only seen. Surrounding area seen and felt. So here edge is raised and everted edge. Typical. Raised and everted edge, very typical of the squamous cell carcinoma. Other edges are sloping edge, healing ulcer, undermined edge is the tuberculous ulcer, and beaded edge. Beaded edge is the typical of the rodent ulcer, BCC. And trophic ulcer is punched out ulcer. In syphilitic ulcer and trophic ulcer, punched out ulcer. The typical ulcer edges which you have to remember in the exam, it will be asked. Is a raised and everted, typical raised and everted edge. The squamous cell carcinoma of the sole, raised and everted edge, typical here. Induration of the edge and base is again typical. Mobility may be fixity, you have to check. Inguinal lymph nodes, vertical group mainly, number, size, extent, texture, tenderness, you have to check. It may be hard. Later external lymph nodes should be palpable above. It gives the idea about the extent of the disease and severity of the disease and outcome. It is above and medial to the inguinal ligament along the line of external lymph nodes. Above and medial it is. You have to always palpate for that if inguinal lymph nodes are palpable. And remember, usually it is a locoregional disease unless patient is immunosuppressed or specific regions. Wedge biopsy of the edge is important, minimum 2 you have to take. MRI foot is very essential here, deeper plane to find out bone involved or not. If it is so, you may have to do amputation to identify depth, extent. Ultrasound, CCT, groin, abdomen for nodal disease assessment should be done. You have to do FNAC. Treatment, wide localization, graft out local flap. Inguinal lymph node dissection is important. Radiotherapy, chemotherapy in eventual time also may be required. Chemotherapy is required, good methotrexate, 5-fluorouracil, cisplatin are quite useful after surgery. Wide local excision, skin grafting, inguinal bacterization is the treatment. Inguinal lymph node examination is very, very important. Here, if it is here somewhere, popliteal nodes also, so mainly in the heel part, popliteal node also involved. So you examine popliteal node also. If it is involved, you have to remove the popliteal node also. That point also you have to remember, examine popliteal node. Peripheral pulse you have to check. Edema is there or not, check. That is also important. Opposite side you have to examine. Opposite lymph node you won't get involved because in lateral, but still examine. Abdomen you have to examine. Iliac nodes you have to examine. Systemic examination also important. So different skin tumors you have to remember. Communistic carcinoma is basal cell carcinoma. Most aggressive carcinoma is melanoma. So epithelioma is still also common. So you have to read all these skin tumors very in detail. It will be asked when this is kept as a short note, when this is kept as a short case in the exam. Oxy they may ask, MCQ they may ask, and theory question also they may ask. So Bowen disease is intraepithelial precancerous condition. Invasive squamous cell carcinoma, basal cell carcinoma, malignant melanoma. Find out the right answer and put it in the comment box, student, please. And Merkel cells are skin touch receptors, skin neuroendocrine receptors, skin pressure receptors, skin pain receptors. Find out which is the correct answer and put it in the box. Students, so please go through my SRB's clinical methods in surgery, current edition. It gives a video like the examination of the different clinical situations. It gives a detailed examination method including history taking of swelling, ulcer, hernia, inguinal swelling, mass abdomen, breast lump, thyroid, neck swelling, salivary glands, all topics including briefly trauma, how to approach, orthopedic briefly. Then it also includes the instruments, specimens, images, briefly operative surgery, entire thing clinical method with a lot of photos, illustrations, each condition photos are there, it's very clear. And analysis, history taking, detail, examination, general examination, history taking, history of present illness and past history, current history, treatment history, drug history, local examination, inspection, palpation, percussion, auscultation, clinical diagnosis, differential diagnosis, and briefly in a table form, all differential diagnosis. But it doesn't contain treatment aspect because clinical surgery book only for clinical surgery, analysis and differential diagnosis. So treatment should be checked in detail, principles of treatment should be checked in the manual, my SRB manual of surgery. So this is basically clinical book with the videos of each examination with all illustrations, principles, different methods, different techniques, science. My SRB manual of surgery current edition gives a CBM syllabus, entirely covers all topic, general surgery, endocrine surgery, thyroid, breast, GI surgery, urology, cardiothoracic, neurosurgery, then other topics, arteries, disease, veins, its principles, methods, clinical methods, treatment, complications, approaches, with the quotations in the each page. It covers entire thing, including treatment principles, brief operative procedure also, not in detail. And it also covers briefly instruments, images, anesthesia, briefly oncological aspect, and daycare surgery, audit, surgical audit, metabolic response to surgery, pain management, everything covers as far as required for the CBM syllabus for UGs, PGs, and coming consultant also, with the illustrations, photos, a few video lectures, and a lot of MCQs online for each chapter with the QR code. Lot of MCQs for each topic, so each chapter it is there. Covers everything for UGs, PGs, CBM, MCQs, NEET exam, whatever required thing. Please go through it. Very, very useful book. My operative surgery, extensive voluminous book, 2-volume book, mainly for postgraduates and learning surgeons. All procedures, including major surgery, GI surgery, general surgery, thyroid, breast, and other things, include briefly gynecology surgeries, with step-by-step illustrations photos, more than 10,000 photos and illustrations are, and which covers everything for to learner. You can, before surgery, they can go through my book and have a step-by-step for the all surgeries, whatever common surgeries, major surgeries, it is there. You can always go through that. In detail, explanations are there. My small atlas of tissue approximation with the videos shows clearly, with the principles, how to suture tissues. Dissection and tissue approximation, there are two parts in surgery. Dissection is a principle, essential. After this surgery, you have to approximate tissues, deeper layer, skin, softer tissues, everything, bowel, GI, everything. So this principle of tissue approximation clearly given in this book with the videos of it, including laparoscopic tissue approximation. So you can always purchase that and go through that. Very, very useful thing to develop the skin, which is essential for all surgeons. Students, I also request all of you subscribe my website, both in YouTube, Instagram, and so on. My DigiNow lectures to the JP Publisher covers around 220 lectures in detail as far as CBME syllabus, from general surgery to specialty, urology, clinical examination, cardiothoracic, neurosurgery, all topic, GI, rectum, anal canal, colon, esophagus, liver, pancreas, breast, thyroid, neck, salivary gland, general surgery, artery, vein, everything in detail, all topics, theoretical aspect, surgical principle, operative surgeries, the examination, clinical examination videos also. It covers 220 lectures, covers everything. 1 year purchase you can do. It gives detailed thing about explanations with wherever MCQs are required. You can make use of it and you can learn surgery properly as far as CBM syllabus and academic wise also. It gives lot of information towards the surgical field as such. So students, I hope you have understood this lecture very well, and also you can go through my books, all these books, with including DigiNow and lectures. Thank you very much. So students, I hope you have understood this squamous cell carcinoma in soul, or squamous cell carcinoma, this topic in my book, skin tumors as such. It will be very, very useful. Thank you so much.